The real issue no one explains. So if these drugs aren't the same, why do they keep producing the same side effects? Here's the truth most people aren't told clearly. It's not that companies like Zoetis are just recycling the same chemical under different names. That's not how it works. But it's also not true that every new drug is some massive leap forward in safety either. The reality, most of these medications, whether it's Apoquel, Librela, Rimadyl, are targeting a small number of core systems in the body: the immune system, inflammation pathways, the nervous system. And here's the key: when you interfere with those systems, the body tends to react in the same limited ways. The pattern explained without hype. That's why you keep seeing vomiting, diarrhea, lethargy, infection risk, not because the drugs are identical, but because the body only has so many ways to signal something is off. Where the real concern actually is, here's where people are right to ask questions. Even though the drugs are different, the overall risk profile often doesn't change as much as people expect. In other words, one drug may reduce organ damage risk, but increase immune-related issues, or reduce daily dosing, but introduce long-lasting effects you can't reverse quickly. The hard truth: modern veterinary drugs are not about eliminating side effects. They're about trading one type of risk for another, making that trade-off acceptable for most animals. What owners should actually take from this? So instead of asking, "Is this drug safe?" ask, "What risks is this drug reducing? What new risks is it introducing? And is that trade-off right for my pet?" Because once you understand that you're no longer just accepting treatment, you're making an informed decision. They're not the same drugs, but they hit the same systems, and the body only reacts in a few ways: vomiting, lethargy, infections. So the real question isn't, is it safe? It's, what risk are you swapping for another? The real issue no one explains. So if these drugs aren't the same, why do they keep producing the same side effects? Here's the truth most people aren't told clearly. It's not that companies like Zoetis are just recycling